Katie go handheld. Welcome Katie to the stage. Katie Jacobs Stanton and I are gonna spend some time talking about her background, equally fascinating, and I think there's a theme here for women who have done some fairly fascinating work. So we'll talk about color and color genomics in a moment, but Katie, will you share your background that is wide-ranging and I think very fascinating for us to bring in this as an example of convergence straight on.
Great. Well, thank you for having me. I have major imposter syndrome here among so many brilliant scientists and people who have spent their really impressive careers in healthcare, and I am a newcomer into this space. So my background has been in consumer technology. Prior to Color, I spent 6 years at Twitter, where I helped build our international business and worked out of Paris and in San Francisco and trying to get more content. I apologize in advance, but trying to get more content and conversations onto the Twitter platform. But that was based in the premise of how do you democratize access to information and how do you give people the information that they need in real time. Prior to Twitter, I worked at Google for also about 5 or 6 years, where I worked on a number of consumer products, including Google News and Google Finance, and there too it was about providing access to information and news and financial information. And prior to that, I was at Yahoo doing something very similar. So so it's very, very different from the place I'm in today.
Yeah, but you're leaving off the little stop off in the White House. I think worthy of mentioning. Just kind of like
That's
took
right.
you at some point you're going to do-si-do back because one sharp right turn from there was just a little stopover in the White House in a newly created position as well, right?
That's right. In college, I studied political science and really was always fascinated by politics and government. But I ended up taking a different path. But while I was at Google, much of the products that we were building, like Google Docs and Google Spreadsheets, had been used by the various different political parties in the 2008 presidential election. As part of that, I got to know both parties and both sides. Personally, I had volunteered for the Obama campaign, and so when President Obama won, I got this call, would you like to come work at the White House? I was like, I think the answer has to be yes. What an extraordinary opportunity. And the goal was, how do you bring technology into the White House, and how do you modernize all forms of government? And it was a really fantastic experience because I had no career goals. I didn't really care about the salary. I was just really there to help and trying to be part of a solution for our country in terms of modernization and accessibility and information. So I spent about 1.5 years working for President Obama.
And now I know that those of you in the room are instantly wanting to go to, right? Little did we know that 8 years later, we want to know about the impact of Trump using Twitter, right? We want to spend time talking about, did Russia infiltrate? But we're not going to. I will hold you back. We only have so much time, and it's equally fascinating. And if we do get through the fascinating content we have on genomics, maybe we can, or you can try and track down Katie to ask all the fascinating questions that you have secondarily. I was letting Manova know as they introduced Katie in the midst of this that I was in you do understand that this poor woman's going to have not only the genomic questions coming at you, but the political fodder in the midst of it as well. All right. So, successful career in tech, we have a stopover in the White House, and then we take a sharp right turn into genomics. So, along the way, also angel investing. That's how we ended up coming to even know about Color. So, again, give us the non sequitur for how does this tech, Google, San Francisco, now we flew to the coast, and now we're coming back again. How do we take a sharp right turn into genomics?
Yeah, I know it all sounds random, so I will connect the dots. No? So the formula I have in my head with any kind of career choice really falls into 4 basic principles. What is the product? Is it something that I would use and something that I feel like I would need? Second, who are the people? Are they smart? Are they decent? Are they people that will make me better? Can I help make them better? How do we work together? I think about pride. I'm a single parent of 3 kids, and my time away from them is so precious. And so I have to be proud of everything that I do. And then the last one is really about impact. if I go in here, can I make an impact? Is it about building something that I can be proud of and I can make a difference with? Or is it just kind of reorganizing things around? Like, it really had to fulfill all four criteria for me. And so after I was at Twitter for a number of years, and I felt like I'd done everything I really set out to do, at the time, on a very personal level, my father had cancer, my brother had cancer, my uncle had cancer. I have a very big family too, so statistically maybe it's all proportional, but it really got me thinking, like, what am I doing in this world? And spending all this time in consumer technology, which is so interesting, but there's got to be a better way. And I thought about those four principles, and I had worked with two of the founders of Color at Google and at Twitter, and they were just such smart people, so admirable, and they could always see around these curves. And I remember when they told me they were starting Color, and I was like, I don't really understand genomics. I don't have that background, but I believe in you, and I believe in the power and how important it is to find a better way for healthcare. And so I became a small investor in the company. And then when I was thinking about my next role, I thought, well, maybe this is worth a shot. And they came up to me, actually, and we were having this conversation, like, why don't you join and become the CMO? And I was like, now, first of all, you guys are the smartest people I know, but that's the dumbest idea ever, because I don't have this background. But now looking back, I realize it's actually really good, because I can come in with a very fresh perspective and ask all the dumb questions and really learn and try to make a difference.
Yeah, I remember it struck me, I think I even wrote it down. I mean, follow the decent was one of the comments. And that, I think, is an area where when you're looking at, 30 billion coming into the space, 4,500 companies in the last 5 years. We talked to strategy officers across the entire ecosystem, let alone us as investors. You really are trying to figure out among the blessing of riches, it's the rise of the entrepreneur, how do you pick the best? And I was really struck by your follow the decent. So tell me about Color Genomics then. So you've gotten past the marketing, gotten past the SNPs, CHIPs, assays, arrays. I did self-disclose as well. We invested in a genomics business called DNA Direct in 2008, and Bill was in United and knew us at that time. I bought the DNA for Dummies book. It was in no, it's time to learn this. It's time to understand. Clearly, this is not something in a personalized medicine space that this is going to be wasted intellectual opportunity. So can relate and shared that in some of our prep call around that feeling of oh my gosh, I don't know this industry, but I feel absolutely so compelled to be involved in it. So tell us about Color Genomics. What do you guys do? What problems are you solving?
Yeah, at a high level, we're a personalized health service empowered by genomics, and the idea that we can make genetic testing more affordable and accessible to people. And we started out, we're a 5-year-old company. We had launched our first product 3 years ago, and we started looking at cancer risk. And so in the very beginning, we sequenced 30 genes looking at your risk of hereditary cancer. And then we expanded it over the past couple of years to include risk for heart conditions, and then as of about a week and a half ago, medication management. So the idea is that we can empower people, a very simple spit-based test that you can send in the mail. It is physician ordered, which is very, very important to us, and I can talk about that later. And that information within a few weeks, you're guided by the results to basically personalize your healthcare plan. So if you carry mutation, obviously for a BRCA1 or 2, you know to get an earlier mammogram, and maybe you get MRIs. If you can't metabolize a certain medication for depression, maybe there's a better one for you to do. So we try to empower people with information that's actionable, that can be used in their healthcare plans, and something that's shared with their doctor, now their pharmacist, but also their families.
So this used to be a space that was, viewed either as recreational medicine or medical entertainment. There were some famous Silicon Valley folks that kind of walked around with spit vials at parties, right, having famous people spit. And so we had to overcome that, and on a consumer side, price points that were in the $900. So you mentioned some really important things about this convergence that's hit the market. You mentioned, clinical, physician ordered. You mentioned a price point in our prep call, and so I want you to mention that here. When we talk about the convergence really meeting its market, and for genomics to become something that can be relevant, integrated into the clinical pathway, and affordable, had been two of the things that really we ran into the buzzsaw from an investor perspective. How's it now? How are you experiencing that price point and clinical integration?
Yeah, so from a pricing perspective, we've been able to drive down the cost considerably. So we have two products. We have a hereditary 30 cancer test that's $99, and that looks at 30 genes. And then we have a 60-plus gene test that looks at a number of conditions. That's $199. The MSRP is $249, but on our Breast Cancer Awareness Month, if you look right now, it's $199.
That would be the act now.
Yeah, act now, buy now. But we've been able to drive down those costs in a number of ways. So we automate our lab. And as we use our sequencers, for example, bringing the best of Silicon Valley, so that's connected to a Slack bot. So as soon as the sequencing is done, there's a little message alert that goes to our lab team to go back and check and see what's going on and do the next thing. So we've been able to integrate all kinds of very simple solutions coming from our engineering backgrounds to be able to drive down those costs considerably at a place and a price point that people are very comfortable paying. We also accept or accepted by insurance, so that is helpful to for people to get covered. We partner with a number of institutions as well that provide color for free for people who can't afford it. So it's really important for us to really drive down the accessibility for people, make it more accessible and useful. And then the second piece about being clinical grade is also a very purposeful thing that we did, because we do think it's important for doctors to be part of this equation. We're not trying to disrupt the doctor-patient relationship. In contrast, we're trying to enable it and further make it better. So from the beginning, we've always made sure that the color test is physician ordered. We do share the results with the ordering provider. If somebody doesn't have a doctor and they don't know who to ask, we work with a third-party network of doctors who will order it for that person.
And how do you deal with translation? I mean, that even to intelligent, educated business professionals, we joke about the genomics for dummies and CHIPS assays arrays, and the formidable aspect of that. A consumer who's at the spot of NA, MI, BRCA1, BRCA2, what do I do about that, even if I am? How have you been able to change that narrative of it being something that can't be understood or is not consumable into a consumable good? How are consumers responding?
Yeah, it's I'm glad you asked. One of the things that we're most proud of, and something that I didn't know anything about when I joined Color, was the power of genetic counseling. And as part of the Color test, everybody has access to free and really unlimited genetic counseling. And when I first joined Color, I talked to a number of our customers to really understand the customer. What was their motivation? What did they like? What could we do better? And what really struck me is that every single client I spoke to had all mentioned their genetic counselor. They remembered them by name. They said, I spoke with Lauren. I felt like I had this very strong, very smart friend named Lauren. And I realized how powerful that was. So being able to have that conversation with customers, so they feel empowered and they know what to do with it. If you have a mutation, here's what you do. If you don't have a mutation, here's what you can do. Here are other people in the same situation that you can talk to. Here are all these amazing support groups and nonprofits that are really helpful to help you understand and contextualize this information.
Yeah, I think that's one of the things that is important for this group to also understand about this opportunity for Convergence is the lack of geneticists that can interpret information. It is a known constraint in the ecosystem. So to the extent that we have an ability in this era where we have democratized data, we've democratized testing, we are practicing at the highest level of our licensure, we're really bringing that relevance to bear. The ability to do that with information, with communication, with translation is vitally important inside of this ecosystem, broadly inside of genomics and its application. So again, I'm gonna hold on the angel piece for a minute and come back to you. So while things are going well, you've reached, you've got some significant tailwinds helping to push. We also talked, in the broader ecosystem, Theranos had its kind of demise in a hype cycle to encapsulate that story. We also had a fair amount of scare cycle in and around genomics, not insurance, not Geno, what would that do? You've been able to really bring together a number of price point challenges, clinical, but what are some of the challenges that Color is still facing in the ecosystem?
Yeah, I think that there are a couple of pockets of challenges. So one challenge is doctors' time. You know, if on average a doctor is spending 10 to 15 minutes with each patient, how can we, help reduce any friction in terms of, we don't want to give doctors a whole other dashboard to look at. We know how busy doctors are, but what can we do to make it just easier for that doctor to get this information that can help him or her make the best decision at that particular time for that patient? So really trying to, optimize for timing for those doctors. I think from a consumer perspective, there are a lot of cultural challenges. I know some families, are very reluctant to talk about the different diseases and issues that may run in their family. And we found that in a number of consumer groups, concerns there. I think your earlier point about not understanding, well, I did this really interesting DNA test. It showed me that I was half French. I already did this test. I'm good. No, you're not. Like, that's very, very different. So how do we really help elevate the conversation and the understanding and an exciting potential of what this information can do to personalize and better our healthcare?
So what are you most excited about when you start to think about where color can go? Similar to what I asked Dr. Lucy. I mean, what's the potential for color? Where do you see? And I know you've had some exciting strategic announcements as well. So tie those into, what are the areas that you're most excited about?
I think I'm most excited for color being the routine part of care. That I do believe in 5 to 10 years, I don't know what the timeline is, but in 5 to 10 years, we will look back in this period of time and think like, I can't believe we didn't know our genes. Kind of like, I can't believe we used to drive without a seatbelt. That's so dumb. And of course we should know our genetics. Of course we want to make the best decisions for ourselves and for our family. So getting color to be a more routine part of care. As a result, we've done a number of different initiatives. We work with roughly 80 plus employers, Salesforce, Visa, SAP, to offer color for their employees, which has been really exciting and a great way for employers to save money, deliver better health outcomes, and keep their employees healthy, but also for employees to feel like, my company cares for me and I can do the best thing for my family. We've also partnered with a number of health systems to offer color for their communities. So we announced a few months ago they're partnering with Jefferson and University of Washington and UCSF. Would love to do some in the Midwest. So any of you folks here, please, katie@color.com. And then another announcement that we had that we're really excited about, we were just chosen by the NIH to do all of this program. That's a big one,
right? I mean, that's one that I think starts to put an asterisk behind your name in a very, very positive way. So spend some time there. Tell us a little, it's a small group, so you can tell us what you can tell us. But I mean, tell us a little bit about what that means for you, what that looks like, what they were interested in, and why color was chosen.
Yeah, it's wild to think that, 15, 20 years ago, we spent $3 billion sequencing one genome. And now we are at a place where we're ready to sequence 1 million genomes here in the US. And it's a race. We see all these other countries, now the UK announced we're going to do 5 million genomes, and different countries trying to really get a leg up. But it's very exciting to see, from the US, how do we advance our understanding? We do have suboptimal health outcomes in the US, and we pay the most. And these don't compute, and Andy did a great job earlier talking about those reasons, and looking at this as a great opportunity for us to do the best thing for our fellow Americans. And we were chosen along with the Broad and a number of other academic institutions because we're clinical grade and we can deliver a beautiful, elegant, high-quality experience at a very low, affordable cost. And so we're really proud of it, and very excited to get started.
Yeah. What do you think this industry still needs to, hasn't converged on? What haven't we brought to the table yet that still needs to be discussed, fixed, to really help accelerate that application in personalized medicine or genomics? Do you have an area that you're really trying to influence in using Color's platform to advance?
I think it's really high level and structural. If we spend 97% of our healthcare budget on treating problems and just shifting that even 10 basis points, I mean, what a powerful thing that could be. Right. So it's more sort of a cultural change, I think, in our country and in our health system, about thinking about how can we do a better job investing in prevention and prediction versus treatment and diagnosis. All of it's important, obviously, but we really need to shift some of the work up front.
Yeah. So I'm going to blend panels on you, and we're also going to talk about some of your angel investing. I think that the story of having been an angel investor and transitioning into a management team member is an interesting one, as well as continuing to be a force for that angel network. So first, the transition from an angel investor into joining the company. You spoke a little bit about it, right? You know, that kind of follow the descent and those areas. But how was that transition? Let's start there.
Yeah, I love that earlier panel. I was like, this is really fantastic and relevant. So when I was at Twitter, there were 5 of my fellow colleagues who all happen to be women. And I remember we were sitting at the lunch table one time and we read an announcement of some company getting funding, and we're like, how come it's just the male colleagues that we know who continue to invest in these companies? We're smart. We have all this great experience across legal, engineering, product, and so forth. Why did they get asked to invest all the time? We want to do this. So we bonded together and created something called #Angels. And the goal was, how can we become better investors? But ultimately the mission of how do we get more women on the cap table of successful startups? Because at least in Silicon Valley, maybe this is around the world, that there are 4 roads to wealth. You're either the founder, you're an investor, you're an early employee, typically an engineer, or you're an executive. And if you look at that kind of that program, they typically tend to be white male. And so we're like, well, you know, how can we diversify that? We know plenty of women and plenty of underrepresented minorities who could do a great job investing. And so we started to dabble in this, and the first company we invested, all 6 of us, was Color. And we looked at the product, we looked at the people, we looked at the market opportunity, we looked at timing. Timing is really everything.
Yeah,
and you know, like, you've been in this space a long time. And so we started to do this a few years ago. I think it was 3 years ago. And over the past 3 years, we've invested in 80 plus companies, from healthcare to consumer to crypto, which I now regret. I basically invested at the high. Now it's very low, so I'm not good at that. But it really helped us really understand these different markets, and also bringing more women to the cap table.
Yeah, and how do you help? One of the things we've found here is that there's also been a bias that investing isn't something, not unlike our conversation around genomics, that investing isn't something that is actually available, that folks have kind of held themselves back from. That's not something I'm good at. I wouldn't know where to even begin. How did you start to change that conversation among those that you brought along with you in the #Angel Network?
Yeah, it's really exciting. Like, it's definitely available. It's definitely there. You just have to raise your hand and say, I want to be an angel investor. And apparently that's all you have to do. Like, we just had a blog post, and all of a sudden we're like, we're going to angel invest. And now we're an angel investors, I guess. But so they're a very low bar. But it was really following the signals and finding other people that we've admired in our careers and telling them that we're interested in learning more. And so we've partnered with a number of VCs to have events, if it could be on the industry of crypto, if it's on consumer, if it's on healthcare or whatnot, and really just networking. And I've been so excited to see a lot of innovation in health, very, very early stage. But it gets me very excited. And just seeing the potential. And we haven't, the one thing I didn't know at the beginning, which I now know, is that it takes a long time to know if you're any good. Yeah. So it can take 7 to 10 years, right? So that's a little bit of a different mindset that I think I've had to really learn.
And how have you been able to manage both? I know we have some angels in the audience, and the working in the system and on the system at times can be a hard element, managing your own day job and then also being involved in these companies. So how have you managed both, or where has #Angels gone while you've been consumed with Color's launch?
Yeah, the beautiful thing, I mean, Color is my full-time job, and it is my love, and I spend most of my time there. But with #Angels, we can turn it up or down as we need to. And because there are 6 of us, and we're all very good friends too, and so when a couple people have more time, they run with it, and when people don't, it's okay to skip.
So the vetting process, you are in the lauded Silicon Valley, right? There's a lot that come to want to emulate that ecosystem. How are you vetting deals? How do you find them? How do you look to determine where you're the right fit for an angel investment in that kind of an environment?
Yeah, I was listening very carefully when you talked about this, and you talked about due diligence, and it's the same amount of work for a $25,000 deal and a $25 million deal, and most of my check sizes are much smaller. So, I rely really, especially because I'm mostly doing seed and A, it is so early stage. There's not even a product most of the time to do any diligence. So I rely mostly on, who is the founder? What does the team look like? How can they sell? Are they decent? Do I believe in them? This is a long-term relationship. Do I trust them? Are they going to make good decisions? Are they going to protect the user and the customer at all costs? Is their timing right? I look at the numbers as they have them and try to make sure they make sense. And that's really about it. I look at other signals too. I don't necessarily look at whether or not they were a prior entrepreneur. I think some people fall into that trap, like, I'm a serial entrepreneur, so you can trust me. Larry Page wasn't a serial entrepreneur. Jeff Bezos really wasn't either. And so I look at some of the more established, successful people, and I don't look at that as such a big signal. I guess that's about it.
Yeah. It's been an interesting one in and around, again, our ecosystem for the angel market. We've seen much of the A round start to pull up, right? And we had a number of folks, and I think fairly so, criticize at times the community in a, if you need $5 million in revenue to get my first A round, my goodness, right? I'm not that I'm de-risking completely, but that doesn't feel like that kind of seed environment. So when you're looking at this nationally, because I know you have national reach among those angel groups, how are you seeing the impact of those angel ecosystems? Hashtag angels expanded nationally, is that right? Or at least networked nationally with a number of other women. Are you seeing hotspots in those communities?
Yeah, we're definitely biased just because of our network. So we see a lot San Francisco, LA, Austin, and New York.
Well, we're going to add Medical Alley.
And now we're adding
that.
Medical
Right.
Alley,
Okay.
yes,
Good.
absolutely.
Good.
And part of it, honestly, is just knowing people. Like, our networks are strong there.
Yep.
As a result, that's what we see. And now that we know each other, I'm sure you're going to send me all kinds of exciting ones, and I will do the same. But I think that diversification is really important. I don't want to just invest in the same companies that have the same people all in San Francisco. I think it's really important to get out. In fact, one of my favorite new ones is a company based out of Austin, and it's called Literati, and it's a children's book platform. And I just love the product so much, and and the idea of making it a joy to read again.
Awesome.
So yeah, send all your ideas.
Awesome. All right. Well, you're going to have to find Katie later tonight when we're at the Mayo Clinic's facilities for our Come On Shay Help Me. The is in the back of your program, which will highlight that you need to go. Thank you. Yes, look at your programs. You will find Katie there. Please join me in thanking Katie. Please join me in thanking Dr. Lucy again as well. Thank you. We are on a break now until we come to our last final panel for the Convergence platform. Really looking at it from a company perspective and from CEOs who are thriving in that ecosystem, from 21-year-old nonprofit to a very, very new and early stage software as a device company. So please come back and please gather your friends. Thank you. Thank you. Oh, I don't know about that.